Well, I'm going to assume that we are good to go. And for those of you who are online with us, you can continue to sign in and everything. We want to thank you for joining us today for the third and final brown bag webinar related to our fall conference that we're holding virtually this year. And what a great honor and privilege it is to welcome back for the second time this year for a town hall with all of our good trucking friends, Governor Pete Ricketts. Governor, you are such a great friend of the trucking industry. We can't thank you enough for being here with us today.
Oh, it's my pleasure. Thank you very much for having me on.
All right, quick disclaimer. I'm sorry.
Go ahead.
I'm just going to throw out a quick disclaimer really quick that we do at the beginning of all these webinars. These are for the members of the Nebraska Trucking Association only. These are not public meetings, and they are not open to the news media. So if you're not a member of the Nebraska Trucking Association, we do ask you to disconnect at this time. So I'm going to move real quick, Governor, just for the folks who need a quick reminder of your bio. You're in your second term now, I have said something about you that I have to confess to you, Governor, that between the horrific, disastrous weather conditions that you faced as governor in 2019 and now the year of COVID in 2020, if you had any hair left, you would have certainly pulled it out by the time your second term is finished. So it's probably good that you came into the office that way.
Without any, right?
Yeah. And I do want to also offer up, and Dave, if you can change the slide, for those who may not have seen it in the news or in any of our social media, last week was Truck Driver Appreciation Week, according to a proclamation signed by Governor Ricketts. We appreciate everything you've done to acknowledge the trucking industry, and in particular, our essential truck drivers and the other members of the industry, the diesel techs, all of the dispatchers, all of the people who are keeping the freight moving. And you know, I brag a lot about you and about Nebraska to other state trucking associations around the country, because during COVID in particular, we saw other states who approached waivers and exemptions for some regulations, that red tape that we all deal with, their governors would kind of just change the color of the tape. They wouldn't really cut anything. They wouldn't really get anything out of the way. They, in fact, kind of made it more difficult. But your approach to cutting red tape and our approach in Nebraska to getting the job done, where when you ask what needs to be waived, what needs to be pushed out of the way, you just push it out of the way. And we appreciate that.
Well, thank you very much, Kent. I appreciate it. And I'm grateful to have the opportunity to be on this afternoon, and for all the work the Nebraska Trucking Association does and all of your members. You know, you hit upon it's the drivers, it's the mechanic, it's the dispatchers, it's everybody who makes this work. And for our state, it is incredibly important because we are an agricultural state. So we have to move our goods to market. That's our number one industry. And then we're also a manufacturing state, which means we got to get our products to market as well. So, I mean, this is incredibly important that we have a strong trucking industry, which we do here in Nebraska. And we are just so grateful for all your work, not only just day in and day out with regard to making sure the commerce of the state runs, but specifically during this pandemic, where it was very difficult. I know the Department of Transportation worked very hard to try and keep rest areas open. We never did a shelter in place order, so we never closed any businesses, which I think also helped keep some of those businesses open across the state. It was certainly a challenging time for everybody, and of course for our truck drivers who had to make sure that our state and nation was fed. It was a particularly critical time for us, and you all performed wonderfully well to be able to make sure that this nation continued to have the supplies it needed as we went through this pandemic. So I'm grateful for all of that.
Thank you, Governor. And you know, we don't hesitate to point out to folks that if you buy it, if you sell it, if you need it, if you use it, however it got to you in the first place, it came by a truck, or at least part of the distance came by truck. And in Nebraska, 48% of all of our communities in the state receive everything they need by truck alone. And when I tell that to people, they kind of stop and let that sink in for a minute, that if trucking stops, about half of our communities completely stop as well. So thank you for acknowledging that. Yeah.
Yeah, and the other thing too, just when you talk about a national perspective, you can reach 90% of the U.S. population by 2 days via truck from Nebraska. So we're a central hub. Obviously trucking is important for our state, but we're a central hub for the entire nation when it comes to trucking.
Yeah. Governor, it's of course hard to have a conversation about the state of things without talking about the pandemic. Nebraska has been kind of on the leading edge of recovery, in my estimation. We recently made headlines again with the lowest unemployment rate in the country. And so if you can kind of give us a sense of where we are today, and then we can talk about where you want to lead us to in the future with this.
Sure. One of the things that we saw here in Nebraska, going back to last February, we were one of the first states that really got involved with this pandemic, if you want to think about it, when we started taking Americans from China and hosting them at Camp Ashland. And then, of course, shortly thereafter, passengers from the Diamond Princess cruise ship. And it was during that process of February and early March when we were getting briefed by the experts at University of Nebraska Medical Center. And we're very blessed to have that resource here in our state at UNMC, because they could really kind of lay out for us what we could expect and how we could respond. And so in conjunction with them, we really crafted a plan that involves slowing the spread of the virus. One of the things they said is, hey, this is a virus, you cannot stop it from coming, no more than we can stop flu season every year. But what we can do is slow it down enough and preserve our hospital capacity so we can take care of those really acute cases. And that has been the fundamental core of our strategy from day one, is really understanding that we have to manage this virus. It's not going to go away. You can't stop it. But as long as we can provide that hospital bed and that ICU bed or that ventilator to anybody who needs it when they need it, we're succeeding. Right now, we're looking at a hospital capacity of about 31% of our hospital beds being available, 29% of our ICU beds available, and 79% of our ventilators being available. And really, those numbers haven't changed dramatically throughout this entire pandemic, which demonstrates the success of our strategy in being able to manage this. We put together early on a 6-pillared strategy for supporting that hospital capacity. It involved making sure that we're doing testing so that we can find who is infected and get them to isolate from other folks. Building out really robust, and on that testing, one of the things we did that was innovative here for Nebraska is we hired a private firm out of Utah called Nomi Health to really create a testing program called Test Nebraska for us. And now Test Nebraska makes about half of all the tests that we've done here in the state, or another way to look at it, we've doubled our testing capacity by working through Test Nebraska. And then the second pillar of our plan was contact tracing, making sure that we had robust contact tracing to support our local public health departments. We have 19 local public health departments, and they're the ones that are primarily responsible for reaching out to people who have been infected and finding out who they've been in contact with. So we can ask those people to, infected people to isolate, people who've been in close contact to quarantine. And we have set a goal of having an additional 1,000 contact tracers at the state level to support the 218 that we have currently at the local public health department level. And testing and contact tracing are kind of the blocking and tackling of how you manage any sort of outbreak. And that's by finding who is infected and getting them to stay away from other people so everybody else can go back to a more normal life. In addition to the contact tracing or the testing and contact tracing, our third pillar is providing PPE for everybody, that personal protective equipment. So we've leveraged the buying power of the state to distribute that through our local public health departments to our first responders, our healthcare workers, our long-term care workers, and so forth. The fourth pillar involves having space for people to quarantine. So we launched our Nebraska Accommodation Project. And the latest iteration of that is open to teachers who may not want to go home because they have a vulnerable person at home, like maybe a parent that they don't want to infect, or maybe they're worried that they would get infected at home and want to go someplace else, so they don't take that into the school. So we provide that resource available. We've done it not only for those teachers that we're currently doing now, but for food processing workers, for first responders, healthcare workers, and so forth. Our fifth pillar is just working on plans for our most at-risk communities like long-term care, where we work with folks to be able to do infection control, testing, webinars on training and so forth. The federal government is helping out. The Trump administration is providing point-of-care testing machines to 188 of our facilities here in the state to be able to test their residents and staff and so forth. So again, taking special care around those most at-risk communities like long-term care. And then, of course, our final pillar is our directed health measures. And these were the restrictions we put in place to slow the spread of the virus. And it included closing at some point some of the target industries or target businesses where we felt there was particular risks, like tattoo parlors and salons and so forth, putting restrictions on things like restaurants to carry out only. But we've relaxed most of those directed health measures to now we're in phase 4. And we did that a couple of weeks ago, or a week and a half ago. And so we're still continuing to manage this virus, but doing it in a way where we ask Nebraskans to remember our rules, to avoid crowded places, to wear a mask when you go to the store, wash your hands often, try and stay that 6 feet away from other folks in public, to be able to manage the spread of the virus as we return to a more normal life. We're also one of the 7 states that did not issue a shelter in place or stay-at-home order. And again, that was really reflecting that we were focusing on our hospital capacity, but understood that there were other costs that go along with these shutdowns. The isolation that come and depression that can come from, being at home by yourself, not being able to go out in public, the increased child abuse, increased domestic violence. There's all sorts of issues. In fact, the CDC came out with a report about a month ago that based on some of their research, high school suicide rates are actually higher than coronavirus deaths. So, there are other costs that go along with being shut down. And so we wanted to avoid those as much as possible as we did that. And of course, we wanted to allow people to return back to a more normal life. In addition to the steps we took with regard to our pillars, we also have received about $9.9 billion from the federal government. Some of it that has come directly to people, like the $1,200 stimulus check. Some of it came through the Paycheck Protection Program, which 44,000 of our organizations here in the state took advantage of. We were one of the highest per capita states in the country with regard to that. A credit to our community bankers who worked on that. And then that pumped about $3.4 billion into our state to help keep things running. We also have received a little over $1 billion from the federal government that we put into programs such as the $330 million we're going to small businesses and livestock producers and in the form of a grant to help keep them open. The $85 million we're doing to nonprofits and childcare to be able to help make sure they can continue to provide shelter, clothing, food, mental health care, childcare, that sort of thing. The $180 million we're doing for state and local government, the $427 million we're putting into our unemployment insurance trust fund, or have set aside for that at least. So a variety of ways to help us recover through this pandemic. And kind of to your point, we have been the least impacted state in the country. If you look at through the first quarter, the Bureau of Economic Analysis did a analysis and said that while the country GDP was down an average of 5%, Nebraska's was only down 1.3%, the lowest in the nation, and states like Nevada and New York were down 8%. And we currently do have the lowest unemployment rate in the country at 4%. Nebraska, and most economists will tell you 4% is kind of a normal unemployment rate. So it shows that Nebraskans do want to get back to a more normal life. We're seeing that here in our state. We want to continue to build upon that. And again, I think that's just a credit to Nebraskans all across the state that they're figuring out ways to manage this virus and keep things moving. So that's really been a lot of our response around the coronavirus pandemic. I think we've struck a good balance here in Nebraska as far as slowing down the spread of the virus. I think out of our 4,000 hospital beds, the last I checked, we were about 190 people in the hospital. We want to continue to manage that, but certainly well within our resources to be able to handle. And by focusing on that hospitalization, we can make sure we take care of people and then let other people go back to a more normal life as we continue to manage this virus. And I think that's what's led to some of the good numbers we've seen. And just one other indicator that we're doing well here in Nebraska is that When the legislature came back in July and August, they did cut about a 1% out of our budget. But so far through this fiscal year, which began July 1st, we have been exceeding our forecasts with regard to the revenue the state would be pulling in. And that's all good news for us to continue to manage the state budget and provide the resources and the services that we do.
Governor, you mentioned the Department of Transportation, and we're big fans of Kyle Schneeweiss, the director there, and his entire team. I need to send him an email complimenting him on how quickly, because I commute between Omaha and Lincoln every day, how quickly they got the projects finished this summer on that stretch of I-80. But in particular, also, we want to offer a shout out to Rhonda Lamb and her whole team over at DMV. We were one of only 7 states, and I know you know this, that never stopped issuing CDLs and other permits. And that's huge to our industry to be able to continue to bring in those new drivers.
Yeah. Yep. And Rhonda and her team at the DMV, and of course, they'll tell you their motto is every day is a great day at the DMV. And it just kind of shows their customer service orientation. Again, just found ways to be able to manage the pandemic. You know, a lot of our services get directed through the local county offices, but we do have our own service centers in Omaha that also remained open through the entire pandemic.
Yeah. So as we look forward, Governor, you know, we hear the headlines every day about how the number of increases in cases, positive test cases, and all these different headlines and that we see that shows that the virus is still spreading, that the pandemic is still very much an active problem. Are there markers that you're watching for that would indicate that we need to revert back, if you will, into stricter directed health measures or other restrictions?
Well, we're going to continue to focus on the measure we've started with, which is hospital capacity. So we're always going to make sure that we can provide that hospital bed, that ICU bed, or that ventilator to anybody who needs it when they need it. And one of the things we've done in the state is we've really managed this as an entire statewide system. And I really want to compliment all of our hospital personnel, whether it's the administrators, the doctors, the nurses, everybody has just been fantastic. And I'll give you an example of how this cooperation works. One of the early hard hit places was Grand Island, specifically around meat processing. And CHI St. Francis did a fantastic job of leveraging the entire state hospital system, that as people came into their emergency room, and they were well prepared ahead of time. I had a chance to tour CHI St. Francis, and they were well prepared before April. But as they started seeing their cases come in and really go up in April, we were able to move people out of that hospital into other CHI hospitals around the state. And frankly, every hospital system around the state volunteered to take patients if necessary. So we've done that with North Platte hospitals and like Great Plains. We've done them with Bryan here in Lincoln. I mean, it's just everybody's really stepped up to be able to take patients if needed. And so that's what we did, is we really moved patients around to be able to do that. And that's what we'll continue to do. And we're actually seeing more of our rural critical access hospitals keeping more patients longer, which also helps us. So really that hospital capacity is going to be the things that we look at. I don't get too caught up in positivity rates or case counts, which a lot of other places do, just because, other than just kind of keeping an eye on it for if there's an early warning indicator, which we did use in some cases like Lexington, when we saw the positivity rate go up dramatically. We knew we had to marshal more resources for the hospital and get ready to evacuate people if necessary. But the positivity rate is one reflection of the spread of the virus, but it's not the end purpose of protecting your hospital system. And that's what it's really about. And again, that's what we got to get back to. And just remember, this is a virus. You can't stop it. You just got to manage it. Right. And so, yeah, we want to keep our cases as low as possible, but there are other costs that go along with that, as we've already discussed. And so you can't make just keeping cases low as the sole driver of what you're doing, because then you will overlook the other costs like mental health care, suicides, domestic violence, child abuse, all those other things that go along with being isolated.
Governor, we do want to throw in that if anybody in the audience would like to pose a question or offer a comment to you, we do have that option available. If you're online with us, you can use the chat function that you'll see. It's probably on the right-hand side of your screen down towards the bottom. You can type in a chat question that will go through our moderator, and we'll be able to send that out. There's also, if you're not online with us, if you're calling in by phone or something like that, and you're able to send an email, you can send that to Dave, D-A-V-E, at nebtrucking.com. So Dave at nebtrucking.com is your email option. Governor,
while we're waiting for some of those things, I was just gonna say, you know, we can hit upon some of the other big projects we got going on here just to kind of bring people up to date.
You bet. That's what
you know, one of the big ones is the Lincoln South Beltway. We've broken ground there. In fact, we've constructed 19 box culverts already, moved nearly 1.5 million cubic yards of dirt. So they're ahead of schedule on that. And then, of course, we'll take a lot of pressure off of traffic going through Lincoln by being able to connect up Highway 2 and I-80, really help freight move much more smoothly. And that project is scheduled to be completed by May of 2023. So that's a big project. It's probably actually, that is the largest project the Nebraska Department of Transportation has ever undertaken. So that's a big deal. But we also have the Fremont South bypass, which is a big deal that will help connect, you know, US 77 and 275 and Highway 30. And again, take some of that pressure off of traffic going through Fremont. And one of the things I want to point about that is that actually got expedited because the city of Fremont was able to work together to get an additional $10 million dedicated toward that. That really helped us at the Department of Transportation be able to prioritize that. And then and that is supposed to be scheduled, that schedule is supposed to be done as well in 2023. And then we also have another big project for Blair with a bypass. And that one, we helped work with Blair to get a $7.65 million grant from the federal government to be able to get that project moving. And we expect construction on that to start, I think in the spring of 2022 is when the folks in Blair are targeting that. So again, we continue to look for ways to be innovative and creative and to expedite some of these important projects so that we can continue to make the flow of freight around our state and traffic much smoother.
Well, and I'll do a shout out to one of our members. I don't know if they're in our audience today, but the project in Fremont, of course, in part was brought about by the poultry plant that went in out there for Costco. And they're members of the Nebraska Trucking Association. We're helping them with some of their trucking safety issues. So
great. Well, they're one of the key contributors to that $10 million too, by the way.
You bet. So tell us a little bit, though, Governor, about the economy, because COVID, of course, even though we fared so much better than just about any place else in the country, and we're recovering, at least it would seem, faster. I know this has got to be something that weighs heavily on you to continue with our economic development and our economic recovery as we move forward. What are some things that you're doing and watching for as we continue down that road?
Yeah, obviously we're going to continue to stay in touch with businesses, particularly small business, because that's where most jobs are created by small business. As I mentioned, we had $330 million set aside for grants for small businesses and livestock producers to be able to help them get through this tough time, as well as the money for example, child care providers and other nonprofits. And as we will continue to measure that as we go forward on this. And keep in touch with them to see how they're doing, because what we want to do is get people back to a more normal life here. And it does mean we're going to have to make some adjustments, but we want to keep those businesses open so that people can go back to work. And having the lowest unemployment rate is an indicator that we have successfully done that so far. And so we'll continue to watch those numbers. We watch our unemployment claims numbers. Actually, I'll give you another one because there's been a lot of talk about it. It has to do with our SNAP program, our Supplemental Nutritional Assistance Program, or otherwise known as food stamps. And one of the things the federal government allowed was that we could take every family up to the maximum allowable amount out of the SNAP program. And we did that through July. And then we discontinued that part of the SNAP emergency program. We continued other parts, such as the kids who were in school and the additional money they could get if they couldn't go to school, that kind of thing. But one of the reasons we did that is because we're looking at our families on SNAP, and we've actually returned to a more normal level there as well. So if you look pre-pandemic, February, for example, we had about 70,000 families on SNAP. We went up to a high of 78,000 families. And then now we're down to about 71,000 families, which is about the number we were in September of 2019. So you can see that's another indicator that we've gone back to more normal. And that's one of the reasons why we discontinued providing the maximum amount of benefits automatically through the SNAP program. And actually, frankly, it's based on income. So if you're a SNAP family and you're lower income, you're going to get the maximum benefits. In fact, about 40% of our families get the maximum benefit on a regular basis anyway. But what we saw is we wanted to make sure that we were stepping down those benefits rather than having a cliff effect where they just get all shut off at once. And that's why we continue to provide some of the things like the emergency pandemic unemployment insurance through August and September to be able to help meet those needs. But again, with the idea is we really want people to get used to this idea. We're going back to more normal. We can see it in our numbers for the SNAP families, but we'll continue to watch things like that as well, those numbers, to see if we continue to sustain the strong economic performance we've had so far.
Governor, the legislative session, of course, was kind of broken up and discombobulated, for lack of a better term. Any thoughts as to what was accomplished and maybe where there was a swing and a miss or just an all-out strikeout as we start looking, because the next session's coming up much faster than what we're used to?
Yeah, well, obviously the legislature just did yeoman's work through this pandemic as well. The legislative session was interrupted in March and resumed again in July and finished up in August. And frankly, this was the most successful legislative session since I've been governor. The legislature passed 1107, which is a key property tax relief bill. We'll add $375 million in property tax relief through a refundable income tax credit on top of the $275 million that we have in the property tax credit relief fund. And that property tax credit relief fund is how the state actually pays directly your property tax bill. You'll see it's a property tax statement. It's a line on there that says credit from the state. And now we're going to add to that program through a refundable income tax credit that will be a credit back based upon how much school taxes you pay. It'll start with an additional $125 million and then ramp up to $375 million over the next 3 to 5 years. And that will, and just to put it in perspective, that $650 million is more than 4 times the $140 million that the property tax credit relief fund started at when I became governor. And what it means is, for example, if you've got about a $200,000 home here in Lancaster County, by the time this gets fully phased in, you'll see about a 17% reduction in your property tax bill. If you have a 980-acre farm in Hamilton County, you'll see about a 21% reduction in your property tax bill. So this is a big step forward. There's more work we have to do on that, but that was a significant accomplishment of the legislature. And in that category of wait, there's more. They also included in that bill the incentive program, so renewal of our Nebraska incentive program, now called Imagine Nebraska. And that is key for us to remain competitive with other states. We've got, last year we had the 3rd most economic development projects of any state in the country. And the 3 years before that, we were #1. So companies were investing here. We want to continue to be competitive in attracting those dollars because it means creating jobs. So, and of course, if we got more factories here, they're producing more goods. That means there's more trucking that has to happen. So that's all good, positive stuff. So we want to continue to see that. They renewed that incentive program. They also committed the state to a project with UNMC that will, if we're successful in getting it, this program from the Defense Department, will mean that they'll create about 8,400 jobs in Nebraska that have an average of about $70,000 a year in income, which is over a $600 million payroll for the state on top of it. So that's a great deal. But they also passed military retirement veterans tax relief to help us hold on to our veterans here in the state. They do such a wonderful job of contributing to our community. After they leave the service, we want to hold on to them. So that was a big deal. They passed pandemic relief, flood relief. They passed relief for the tunnel collapse we had in western Nebraska last year because of the bad weather we had. They also were able to pass one of the most significant pro-life bills we've had in a decade. They passed our college and career scholarship program to be able to train Nebraskans to be future leaders. So this was a very, very successful session, and the senators really ought to be congratulated on it. If there was one thing that didn't happen is we were really looking to have some more fiscal restraint on those expenses at the local level for property taxes. We weren't able to get that done, but in the grand scheme of things, this is all, you know, when you're dealing with the legislature, right, it's a negotiation, it's a give and take, it's a compromise. And so, again, I'm very, very pleased with the legislature and the work they did this year, because it really was, even though we didn't get everything we wanted, it was a really good year that the legislature was able to produce.
All right. Well, Governor, we promised your scheduler that we would not keep you past the 30-minute mark, and I have to respect your time. So again, on behalf of the Nebraska trucking industry, we want to thank you for all of the support that you've shown, the way that you cut the red tape for us when we are desperate to move freight through these challenging times. And we look forward to following your lead as we move into down this road to recovery.
All right, well, great. Hey, well, thank you very much, Ken. I appreciate it, and I appreciate all that you and your members do to keep Nebraska moving forward. It's awesome.
All right, and we're going to wrap up, Governor. As we let you go, we have we weren't able to get a live feed from Senator Deb Fischer out of Washington with the Senate in session. However, she did take time, excuse me, to send us a video message. So if everybody will stay with us here for just a second, Dave is going to call up our special message that we've received from Senator Deb Fischer. Dave, let it roll.
Ever since I was first elected to the Nebraska legislature, I've understood how important smart transportation policy is to Nebraska and to the country. As your United States Senator, I have
Thank you, Senator Fisher. We do appreciate your support and all of your efforts. Want to draw your attention to just a couple quick things before we sign off. I believe you might be seeing some great screenshots. If you'll visit nebtrucking.com, there are all kinds of photo albums that can show you some of the Truck Driver Appreciation Week events that we've held, some of the earlier Driver Appreciation Weeks that we held throughout the state during the COVID crisis, as well as all of our other events that we continue to put on for you here at the Nebraska Trucking Association, whether virtually or in person. And with that, we hope to see so many of you tomorrow at our trap shoot, our foundation fundraiser golf tournament, and of course, the Fall Family Festival that we're having, a first ever event to celebrate our anniversary and give out our of the year special awards tomorrow night at Werner Park in Omaha. Until then, God bless Nebraska. God bless you. And we hope to see you very soon. Kent Grisham from the Nebraska Trucking Association. We'll see you tomorrow.